I think erectile dysfunction is something that many men are worried about as they get older, and age is definitely a factor. Yeah, so as you get older, the erections can potentially get weaker. Yeah, and of course this can be accelerated when you have certain comorbidities or medical problems. So if you're a diabetic, if you have diabetes, or if you have high blood pressure, or even if you have high cholesterol, all these things can cause vascular changes to your blood vessel, and these changes to your blood vessels can contribute to erectile dysfunction. So for a man to have erection, you must have patent blood vessel to the penis. Yeah, and so understandably, when there's changes in the blood vessels to the penis, then this will also lead to reduced blood flow and therefore contribute to erectile dysfunction. Now, another factor that contributes to erection is your nerves. So your nerves that supply the penis also needs to be intact, and that's why when you have conditions which affect the nerves that supply the penis, this also leads to erectile dysfunction, and this can happen in those who undergo surgery in the spine, for example, or if they have spinal injury. In motor vehicle accidents where they have injured spine, can result in erectile dysfunction. Even pelvic injuries, those who have very severe pelvic bone injuries or hip bone injury can end up with erectile dysfunction. Diabetes also can cause problems with the nerves as well as the blood vessels, and therefore diabetes is one of the main causes of erectile dysfunction that we see in Malaysia. So these are some of the causes, and of course we cannot also ignore the fact that maybe psychological problems can also contribute to it. This includes things like depression, anxiety, all these factors, including stress. So if you're very stressed out in your job, you don't have any time for yourself, you're not relaxed, then of course this can contribute to ED as well. And smoking. I think one of the things that we often don't pay enough attention to is smoking. Yeah? So if one is a heavy smoker, especially if you've been smoking for many years, then this can contribute or even accelerate erectile dysfunction at a young age. And one of the things I want to highlight here, which I think is important, is that if you do suffer from erectile dysfunction in your 40s, studies have shown that this is an indication for cardiovascular disease or heart disease 20 years down the line. So this is actually an alarm sign. So if you're having erectile dysfunction at a young age, then you should definitely relook at your lifestyle. You need to make some lifestyle modification, because otherwise 10-20 years down the line you may actually suffer from a heart attack. Yeah, so when we have a patient who presents to us with a complaint of reduced erection, the main complaint usually is that they cannot sustain their erection. So during sexual intercourse, they are unable to sustain erection for sufficient satisfaction during sexual activity. So this is more or less something that we gather from the history. So important is history taking. Now there are also certain tools that we use, and one of the things that we can gauge in terms of the severity of their erectile dysfunction is by using something known as the Erection Hardness Score. So Erection Hardness Score is a tool something like this, where we actually classify erectile hardness with a score of 1, 2, 3 and 4. So 1 essentially means that there's hardly any erection. 2, there is erection, but it's not sufficient for penetration. With a score of 3, you're able to penetrate, but it's not sustained. So ideally you want to achieve a score of 4. So typically we get the patient to press on this little button here, and they can tell us at which level is the maximum hardness that they can attain. So this is known as EHS, or Erectile Hardness Score.